As you know by now, this move set off confusion for the 1.21 million fully vaccinated Americans. You and Dr. Fauci and President Biden told them that they didn't need to wear masks anymore. Almost 20 states, plus companies like Walmart and Starbucks, they're lifting or relaxing their mask mandates. So did you mean for this guidance to result in stores and local governments lifting those mask mandates?
Good morning, Dana. Thanks for having me. I think we should just take a moment and pause and celebrate where we are in this moment. Cases have come down by about a third just in the last 2 weeks. Our death rates are as low as they have been since April of 2020. And vaccines are available and eligible. Everyone is eligible above the age of 12. So we have plenty of vaccine, and the science, as you just conveyed, demonstrate that they work. And so that is what allowed us to make this guidance at the individual level. This was a first step. It was foundational guidance. Everybody is really thinking about what this means now at this moment, 16 months later, as we really think about opening up. And we needed to sort of set this foundation based in the science to make sure people understood as they make their recommendations moving forward. And we are doing the hard work with them to make those recommendations.
Yeah, and I understand what you mean about a first step, but can you see, since this is big news for every American, can you see how your guidance that vaccinated people can take their masks off, but requirements from businesses, local governments to keep the masks on are sending a mixed message?
Here's what I know. I know that we need to do the hard work. This was individual guidance to understand what this means for communities, what this means for businesses. We know at the individual level, the vaccinated people are safe. More than 1/3 of Americans have been vaccinated, over 45% of adults above the age of 18. Those people are safe when they get vaccinated, after they're fully vaccinated. For those who are unvaccinated, we're really asking those businesses to work hard to make sure that they have available vaccine for those people so that they have time off, so paid time off, so that they can get their employees vaccinated. Mm-hmm. And for those people, we really are asking them to get vaccinated or wear masks to keep themselves safe.
And what you're describing relies on the honor system for unvaccinated individuals to wear masks. I want you to listen to what the United Food and Commercial Workers Union leader said on CNN this week about that.
They were actually, verbally abused, and in some cases physically abused by some of the customers. So now we have a situation where you really don't know whether or not somebody has been vaccinated or not, and you're going to change them from the mask police to the vaccination police.
What's the remedy for this, in your view? Should businesses even try to tell who's vaccinated and who is not? Otherwise, it's a free-for-all, as you just heard described.
Yeah, so first I want to convey that we are not saying that everybody has to take off their mask if they're vaccinated. And it's been 16 months that we've been telling people to mask, and this is going to be a slow process. The other thing is that every community is not the same. Not all communities have vaccination rates that are high, not all, and some communities still have case rates that are high. So these decisions have to be made at the community level. But what we're saying to those essential workers is that if those workers are vaccinated, they are safe. So we are really asking the businesses to work with their workers to make sure that they have the paid time off to get themselves vaccinated so they can be safe.
Even the local businesses are relying on you and your guidance to decide what to do and how to function.
And I completely acknowledge that. My job as the CDC director, which I promised the American people when I took it, is that I would deliver the science to them and our recommendations to them as we had it. We had 2 studies that were published the week prior to last, a major study that was published in the MMWR on Friday that demonstrates that vaccinated people are safe. Now we have the hard work to do. This was the first building block. We as a society have the hard work to do, and we at CDC are doing that work to say, what does that mean in the whole plethora of settings that we have in childcare settings, in retail businesses, in schools, in camps, in travel? What does that foundation, that science that we delivered on Thursday, mean for all of these other settings?
I want to ask you about a scenario that Dr. Lena Wen wrote about in the Washington Post. Here's what she said. She said, let's say you go to the grocery store. It's crowded and few people are masked. Perhaps everyone is vaccinated, but perhaps not. What if you don't have childcare, so you had to bring your kids along? They didn't choose to remain unvaccinated. The shots aren't available for them. Surely it's not fair to put them at risk. So let's just get practical here. Is it safe for that unvaccinated child, even in a mask, to be in a grocery store when people around them could be unmasked and not following the honor system because they're not vaccinated?
Thank you for that question. We were going to be at this period of time. We knew that there was going to be a time where we had the majority of Americans who wanted to be vaccinated, and yet the children were not going to be eligible yet. And we are working really hard. Let's celebrate the fact that this week we also got news that we can vaccinate our 12 to 15-year-olds. We hope by the fall, by the end of this year, we'll have vaccine eligible kids eligible at even younger ranges. And what we're saying is those kids should continue to wear a mask in those settings. We recognize the challenge of parents who can't leave their kids at home, should be masked in those settings, and to the best of their ability to keep a distance. The recommendations for those settings have not changed.
And do you trust that people who are not vaccinated, given what we've seen over the past year plus, will actually keep their masks on?
You know, I think that people who were not inclined to wear a mask were not inclined to wear a mask before Thursday.
But some of them were mandated to do so, and those mandates are lifting in part because of your new guidelines.
Yes, and what we're really asking in those settings is to say, in terms of the honor system, people have to be honest with themselves. You're protected if you're vaccinated. You're not if you're not vaccinated.
Just to follow up on something you said about children younger than 12. You said the fall or the end of this year. Is the timeline changed? Because things seem to be moving pretty rapidly.
No, the timeline hasn't changed. You know, a lot of this is how many cases they have, what their endpoints are. So we're really, you know, not all of this is something that we can accurately predict, but I'm really hoping by the end of 2021.
Okay, so let's dig down on those younger kids in general, and summer camps. You know, we're as parents making plans for camps for our children. CDC guidelines right now still require distancing and masks at all times, including outdoor sports. There are exceptions, of course, for eating, drinking, and swimming and sleeping. What should Americans expect when it comes to summer camp guidance? Will there be new guidance, and how quickly will it happen?
Yeah, so first I want to say with regard to schools, because we've gotten a lot of questions about schools. We have asked that schools we will not be changing our guidance for the end of this school year. Most kids will not be vaccinated or fully vaccinated before the end of this year, and we're going to work on updating our school guidance. But your point about camps is really important. So much evolved just in this week, both with our guidance with unmasked if you're vaccinated, as well as the eligibility of vaccination for 12 to 15-year-olds. So yes, we do have to rapidly update our camp guidance, and we're working on that right now.
Okay, and you said on PBS this week, quote, what we would recommend is for those with immune compromising conditions, as well as really any other conditions that affect your health that put you at high risk for disease, that you consult your doctor before you take off your mask. That's a lot of people you're talking about. So can you clarify what exactly you mean? Are you talking about people who are obese? Are you talking about people who are pregnant, have diabetes?
So for the most part, the studies that are evolving now are for people who have immunocompromising conditions or on medications that interrupt their immune system. So people who have had transplants, people who are on chemotherapy. There's been at least one study that demonstrates that if you're on a dialysis patient, that you may not be as well protected at all. So what we would recommend is certainly for people who have immune compromising diseases or on those medications to consult their physicians. And really, again, not everybody has to rip off their mask because our guidance changed on Thursday. So yes, if you are concerned, please do consult your physician before you take off your mask.
If you were a pregnant woman, would you keep your mask on?
We're encouraging pregnant women to get vaccinated. We do have increasing data now that pregnant women should get vaccinated. That's going to really be an individual by individual decision. And so, you know, it really just depends on how much risk you're willing to tolerate, how hard it is for you to wear that mask, how much disease is in your community.
Are you aware of any fully vaccinated individual who has died of COVID-19?
We do keep a track of this on our website. We are asking hospitals and healthcare facilities to send us cases of what we're calling breakthrough infections. They occur, they are rare. We are aware of 223 as of May 10th that are among the 115 million people that had been vaccinated by that time. I also want to convey that now many hospitals are screening people for COVID when they come in. So not all of those 223 cases who had COVID actually died of COVID. They may have had mild disease but died, for example, of a heart attack.
So you said 223 cases, but no confirmed deaths of people who are vaccinated from COVID.
I'm sorry, there have been 223 deaths out of 115 million people who have been vaccinated. An extraordinarily low rate when you consider the death rate of COVID itself.